All right, so today I will be talking about assessing child and youth mental health in a community-based setting. This is all coming from my practicum experience, which took place from May to August this year. Even though we're not all gathered together at Queen's campus, I would like to just say that Queen's University is situated on traditional Anishinaabe and Haudenosaunee territory and would like to acknowledge that. So before diving into talking about my practicum, I just wanted to give everyone kind of a brief overview of what the practicum is. So it's an opportunity to synthesize, integrate, and apply public health knowledge from courses and really just develop skills. So the particular project title for my practicum was an evaluation of Multi-Center's 18 to 24 mental health walk-in clinic. And as I take you through this presentation, I guess you'll kind of see how the goals of this project shifted from being a true evaluation to kind of where it ended up today. So some of my learning goals going into this practicum, I really wanted to develop my program planning, implementation, and evaluation skills and diversity and inclusiveness. And this really just stemmed from a desire to work with different populations. Some other transferable competencies I wanted to develop or continue to practice were really my conflict resolution and critical thinking skills. So that brings me to talking about Multi-Center, where I completed my practicum. So in the top left-hand corner here is a picture of Multi-Center. I've only ever been to this building once in person, and that was last February for my interview. Multi-Center is located in Kingston though, and it's actually only about a 10-minute walk from where I'm living right now. So a bit more background. Multi-Center was originally established as Pathways for Children and Youth in 1996, and just a few years ago they changed their name to Multi-Center after its founder, Joanne Maltby. It is a registered charity and not-for-profit, and then staff who work there come from a ton of different backgrounds and have a lot of different levels of education, and all of them work together to provide community-based mental health and autism services within the Kingston, Frontenac, Lennox, and Addington area. So some of the services Maltby offers are walk-in clinics, counseling and therapy, and parent education services for ages 0 to 24, and then their caregivers. So Multi-Center's vision in a nutshell is kind of advancing thinking and action in mental health and autism through collaborative leadership by offering services that give every child, youth, and family the chance to thrive. Interestingly enough, it's not actually a public health agency because its focus is on treatment as opposed to things like prevention and promotion. However, a lot of the competencies practiced by its staff are the same ones that are practiced by those within the public health system. And Multi-Center does work closely with a lot of community partners towards prevention and promotion in mental health. So this is the part of Multi-Center that my practicum focused around. So this particular program that they offer is the 18 to 24-year-old mental health walk-in clinic. This program was initially piloted in January of 2020, so just 7 months ago, using an RBC and Ministry of Health grant. So this provides free access to counseling with a registered psychotherapist and with no appointment necessary. So really helping to increase access in the community and decrease wait times for other counseling services. So it offers a 1-hour solution-focused therapy for any mental health need. And it's also open to returning clients. So just meaning that you're allowed to access the walk-in clinic more than just once. And this is a first of its kind service for transition-aged adults. So that's your 18 to 24-year-old population in the KFLNA area. And it did change from a walk-in clinic model to mental health access in March 2020. So mental health access is a virtual model, so people can call in and then they can set up a virtual appointment with a therapist. And this is just because all of Multi-Center services changed to being delivered remotely with COVID-19. So that brings me to my actual practicum project. So it is an evaluation of this clinic. So when I initially started this, sort of the goals changed, and that was just due to remote work. So I was kind of given this project, said, okay, this is kind of the background on it. So the first thing I did was create a logic model, and this was just to kind of describe the program, understand the sorts of barriers people were facing to accessing it, understand who the clients are and where they're coming from, and then the goals of the clinic, which is overall to improve the mental health state of 18 to 24-year-olds. I also looked at some current process measures, so just did a quick analysis of client characteristics. So these are things like age and gender and reason for accessing the clinic. And then also looked at different satisfaction surveys that were completed after a visit to the clinic. So this is where we could see whether mental health did improve at all immediately following an appointment. I did a quick assessment of the target population and different KFL&A demographics. So just understanding the people we are serving in this region and the sorts of things that are affecting them. So different things, even like sorts of language, whether it's French or English speaking populations. Do they actually live here, or are these people mainly students who are coming in from different areas or not? And then I also completed a literature review for best practices and then different evaluation methodologies, which would eventually inform future program evaluations following my project. And all of this was kind of done to help to inform future grant proposals. So right now the current funding for MALT-B in this project just goes until January of 2021. So through the summer, we were submitting more grant proposals to see if we could secure future funding. So my next few slides, I'm just going to share a few snapshots of a summary infographic that I shared with staff based off of a report that I created that discussed access and use of services for this 18 to 24 walk-in clinic. So first thing I did is kind of describe 18 to 24-year-old mental health. So 18 to 24-year-olds do experience several unique factors that increase the risk of poor mental health and not receiving adequate care. So this can go with living by themselves for maybe the first time, stresses with school, and just having different levels of support from family and friends. This is all also influenced by the social determinants of mental health, so things like housing, culture, level of education, and sex and gender. And 35% of those who experience mental health difficulties do not seek help. So this could be a big or a small number depending how you look at it. I looked at it as 35% of people who do not even look at seeking help, rather than those who will maybe seek help but then not be able to access it. So that brings us to barriers of service use. One of the primary things that prevent people from accessing mental health treatment are service gaps from child and adolescent mental health to adult mental health services. So 18 to 24-year-olds are a transitional age group, so they kind of fall into this gap between services being offered for children when they put age limits on it and adults, and there's no real policy in Ontario to support this specific age group in finding mental health treatment. Different personal characteristics like low help-seeking behavior and poor mental health literacy. So this is just an inability to recognize the different symptoms associated with poor mental health. Stigma around help seeking, and then different institutional barriers like wait lists for counseling, the financial costs associated with therapy, and then just not being aware of what services are available. So the whole goals of kind of putting all of this together is how can MALT-B Center use evidence-based practices to increase access to service, promote recovery and prevention, stimulate engagement, and overall support youth facing things like depression, anxiety, and stress. And these were just some of the most prevalent conditions that are apparent among 18 to 24-year-olds, but definitely not a full list there. So some of the messages in marketing that we really want to promote when we talk about access are increasing mental health literacy, removing barriers, and then reducing stigma around help seeking. And underlying all of these is just the whole idea that personal empowerment is a leading factor in the use of mental health services. So how can we empower youth to seek help and access good quality care? The Opening Minds campaign was one example that I looked at, and they produced a guide for media reporting on mental health. This was designed to engage many different group sectors to lessen perceived stigma and then, in that sense, empower individuals to access care. So this list included everyone from healthcare providers right down to the youth, so 18 to 24-year-olds who can feed back into the system and say, this is what's working, this is what isn't. So how can we connect with 18 to 24-year-olds? 50% of 18 to 24-year-olds engage in some type of post-secondary education within Ontario. So a big place where we can target this group is at colleges and universities, and then including this group and others that we're not hitting are from community-based walk-in clinics. So these are just an easy way to access mental health care in a community-based setting. Another big way, 90% of 16 to 24-year-olds own a smartphone and use it as a primary source of information. This is a pretty big number, but when I was doing this whole review, I actually realized that I fall into this 18 to 24-year-old age category, and it's definitely true. My phone's the first thing I pick up in the morning and probably the last thing I put down in the evening. So most of the information this group is getting is coming from social media, so Facebook, Instagram, and Twitter. And one study did find, and actually multiple did, but the one that I'm citing here, found that those exposed to positive mental health messaging through testimonials are more likely to seek information relating to mental health issues. So the other side of all of this is to talk about the type of therapy that is being employed in walk-in clinics, and particularly by multi-center. So single session therapy, or SST, is a type of brief service that can open the door to more resources, new knowledge and skills, and improved hope and coping and decreased problem severity. There's a ton of evidence in the literature pointing to the efficacy of single session therapy. So here I've just made kind of a list of the best practices that can be employed by walk-in clinics using SST for 18 to 24-year-olds. So services should be family-oriented, so engaging not just the individual, but also their family and support system. There should be a range of interventions to address many types of issues, and then joint working with other agencies. So this is just being able to point individuals towards other resources they can access. All therapists working in these types of clinics should have a mix of child and adolescent mental health and adult mental health service expertise. And this is just being really flexible so they can meet the needs of the individual coming in. And then an emphasis on building solutions. So this is dealing with the immediate presenting problem rather than going backwards and saying like, okay, this is your issue. What might have caused it? What other underlying issues might you have? So that being said, there are limitations of SST, and the biggest question is one session enough for this age demographic? And the simple answer was just that more research is needed. So this type of therapy is ideal for some individuals, not for others who may be experiencing more severe symptoms. And that's where you might see some studies pointing to maybe a positive dose response trend where more therapy corresponds with better mental health outcomes. So moving forward, since opening in January of 2020, the 18 to 24 walk-in clinic has served 25 individuals. So when I was doing my whole sort of assessment on different process measures and everything and looking at who's been attending this clinic, this is a very small sample size compared to the number of people that are accessing the rest of multi-center services. So multi, what they were really looking for from me was how can we increase our reach? So my recommendations based off of this report are just to continue to implement best practices. So those go with our best practices within the clinic and employing single session therapy, continuing to analyze client participation and feedback, so the whole evaluation piece, increase social media marketing of services, so raising awareness, and then partnering with Queen's University, St. Lawrence College, and RMC. So these are the three major post-secondary institutions in the KFLNA area who do have a huge influence and reach over this 18 to 24-year-old population. So that brought me to my next steps. So based off of this whole review, all the findings were shared with RBC, staff therapists, management, community partners, and the Youth Advisory Committee, which is a group of youth who help to inform MALTB on sort of what's working with their programming and what isn't. So the next big question came down to funding. So I talked to the walk-in clinic managers and they kind of said, we don't know where we want this program to go. So whether if we do secure more funding for this program in the coming year, should we be offering maybe long-term counseling for clients, just continuing with our current walk-in clinic? Is it being used? Like if people aren't accessing it, is it worth continuing this service? So there's still a big question mark next to that. So I'm hoping to be kept in the loop on where this program goes because I did become very attached to it this summer. Other presentations were made to Queen's University and St. Lawrence wellness teams who did agree to help to promote this clinic among students. The next part was a huge social media campaign, really. So before this, Maltby Center had more of a limited social media presence. So I was helping to create a bunch of different marketing tools that aim to increase mental health literacy, describe the goals of the clinic, and then reduce stigma around help seeking. So these are just a few samples of what I came up with. Another big campaign that I piloted was the Meet Our Staff campaign. This project was really cool because it allowed me to meet with different staff members throughout the entire agency, not just on the mental health side, but also within autism and administration. So I worked with different staff just to create short bios of themselves that were put with a picture, and all of these are eventually going to be shared on Maltby Center's webpage. The whole goal of this was just to kind of make Maltby Center be seen as more of a friendly and inviting agency. We found, especially with the switch over to remote services, like you can never really connect as well with a person on the other side of a phone if you haven't seen their face before. So we just thought this was a great way to kind of better form connections with people in the community. And then, of course, mental health and COVID-19. This was started as more of a personal interest project, but then I did write an article that was submitted and published by Queen's Journal that explored virtual SST as a mental health treatment both during and post COVID-19. So obviously the effects on mental health due to the pandemic are huge. But in this op-ed, I was able to highlight Maltby Center as a leading community agency in delivering virtual SST and sort of its benefits here. This was just really cool because Maltby Center did a phenomenal job of shifting to virtual services. Prior to the pandemic, they hadn't done anything virtually, and then within the space of the week, they had all of their counseling up and running online. So just to kind of summarize everything here, a big part of the practicum was reflection. And this was definitely helpful in just finding value in everything that I was doing. So there's definitely challenges working from home. There's so many distractions, and then just working out your schedule and being accountable for your own time. The nice thing was that everyone was working through these sorts of challenges together. So in my day, when I'd sit down for 7 or 8 hours in front of my computer, one thing I really struggled with was asking questions and building connections. I found it so easy just to sit down and have these questions and then forget to reach out to people because you're all alone. But just remembering that everyone really is only a click away. And right now I find everyone is so willing and so ready to just lend a helping hand. My biggest takeaways from the practicum, huge skill development. I spent a lot of time working with Excel as well as our client database this summer. So just doing things in the realm of data analysis and assessment was huge. It also kind of fueled my desire to continue to learn. So I'm definitely excited to be back in classes this semester to kind of consolidate everything from this practicum. Also planning next steps right now. I think one of the questions I get the most frequently is like, okay, so you're a year into your master's, you've done your practicum, what's next? What do you want to do? And one of the scariest things is that I still really don't know. This summer, I think the best part about the practicum was just an exposure to different fields within public health again. And that's really why I decided to get into public health in the first place, was because I love how broad and dynamic this field is. And there are always so many different opportunities for learning and for growth. Another huge takeaway was the importance of self-care. So Maltby had a great policy this summer for its employees. So with the shift to remote work and everyone was at home, Maltby Center required that its employees work for 75% of their workday, and the other 25% should be devoted to self-care. So whether that was going for a walk, hanging out with your family, just doing chores around the house, whatever it was time for you. So I really tried to instill this balance into my own life this summer, and it was very important to kind of balance everything with just working remotely and focusing on really just doing a practicum. So these pictures are just kind of some examples of what I did this summer. Definitely a water theme going on, but lots of days at the beach or early morning swims down at the pier in Kingston. and going for camping trips. All of this was just a great way to really balance out the work of this summer. So I just want to wrap up by saying that the opportunity to continue this project during a pandemic makes the experience of making connections that much more valuable. In the past months, I've had the chance to observe how truly passionate people are about their jobs, helping others, and how Multi-Center operates as a workplace. Everyone is incredibly supportive of one another and working towards making the program the best it can be in order to make a difference in people's lives. And all of these qualities are things that I aspire to, so it was very inspiring to see those in action this summer. So that brings me to the end of my presentation here. Thank you very much for listening and for the opportunity to speak. And after that, I'm just going to stop sharing my screen now, and I'm happy to take any questions if anyone would like to unmute themselves.
I can't, so I'm going to clap, Kathryn. I don't know if anybody else wants to do that, but thank you.
Kathryn, I have a question.
Yes.
Okay, so excellent presentation, by the way. Very well done. I've learned a lot more about Multi-Center. You listed a number of barriers, and one of which is making sure that the services are known to the community. And you've gone forward with contacting the universities and the colleges around the area. And one thing we found was in tobacco control, trying to get people to quit, we weren't reaching the people that were beyond in the post-secondary institutions. So say, for example, people that are in the trade sector or working in hospitality. So was there any discussion as to how those populations would be reached in terms of awareness?
Big discussion on that. So 2 ideas we kind of came up with. One was just reaching out through our other community partners right now. So Resolve Counseling helps with adult mental health counseling in Kingston. So they're agreeing to help to promote Maltby's services. So our idea there is that a lot of these populations are already seeking counseling services or are maybe by word of mouth are able to refer people. So by pushing through these community partners, we're hoping to get the word out. And then the other side of that was our social media reach. So maybe we're not reaching just post-secondary people that way, but hopefully we're helping to reach a lot more people. And a lot of these ideas also came from our youth advisory committee, and they were suggesting things like, can we create different videos and different testimonials in that sense that we can just even put out on our webpage. And then a huge part of it is word of mouth. This summer, I talked to so many people who still only knew Multi-Center as Pathways for Children and Youth. So really just tying in our services so people are aware that they still exist, only under the name of Multi-Center.
Yeah, no, that's great. Thank you so much. And let us know how it turns out for moving forward with the clinic.
Yes, absolutely.
Hi, Kathryn. I put a question in the chat, but just to reiterate in real life here, can you expand how COVID-19 changed the uptake of the service? So you didn't talk about mode of delivery, maybe being a barrier or a facilitator. So I would say that like online mode of delivery might actually be preferred by some people. I'm not sure if you did any kind of thinking or analysis about that.
So Supriya actually was also working at the Multi-Center this summer, and her entire project focused on kind of evaluating the shift to virtual services. So she did a lot of work on how virtual services can be delivered and whether people prefer that as a mode of delivery and how that's affecting our numbers. So I'd say just from having seen some of these presentations and then part of my own analysis, the number of people accessing services to start with definitely went down. And that just came from a lot of hesitation about using virtual services. So people didn't like not being able to connect with someone one-on-one. They felt like they were losing a lot of that in-person contact. And then it's also just hard because you're never in a private space. Like even from a therapist point of view, you could make sure you're ensuring privacy, but your client on the other end might not be able to speak privately or confidential or confidently, and make sure that like they're not being overheard or anything. So that was a big issue with the transition to virtual services. I'd say right now, Multi-Center reopened by appointment only in July to book an actual in-person counseling session. So right now, people still have the choice about whether they would like a virtual session or in person. And it was actually an interesting in the numbers, because it almost seemed like for younger clients, they were preferring in person rather than having a session over Zoom or anything like that, which kind of made sense. And then for older people, they were finding that actually the virtual care was working really well, having that option, because it is more flexible that way. I don't know, I just want to make sure I kind of answered your question there. So yes, so kind of to sum up, it was kind of a barrier, but now I think Multi-Center is realizing that it also has huge advantages. You can reach more people. They're not limited by things like having to get physically to Multi, so no transportation barriers. So moving forward, they definitely want to keep an option for clients, so to have both virtual and in-person services available. Just looking in the chat, and I see another question. It says, you said that the single sessions were used by 25 people. Were these services available to post-secondary students only, or did homeless youth access these services as well? If yes, was an online mode of delivery a barrier for these people? So of these 25 people, just most of them were actually returning Multi-Center clients. So we weren't really drawing in any new people. From the walk-in clinics as a whole, though, I also did an evaluation of just seeing like where everyone who has ever accessed the walk-in clinic were coming from. And I don't know so much specifically about homeless, but there were definitely people who had insecure housing. So yes, online mode of delivery would probably be a barrier, because again, it goes with having a secure environment on both ends to access these services. So it would be a barrier that we would want to overcome. I know some clinics in the area were thinking of almost reverse scheduling for appointments, in which individuals at home, so if I were seeking counseling, I could go into Multi, but there would be no therapist there, but I would have a private office or a private room to myself where I could have the appointment. So I know a few places were kind of investigating that as an option when everything moved online.
Are there any other questions for Kathryn? No? Okay, well, I'd like to thank you for attending. Kathryn, thank you very much for your time and sharing your practicum experience. I wish everyone to have a great day, stay well, and take care.